Hello! Welcome to the Donning and Doffing video. These are steps for proper donning and doffing of personal protective equipment, more commonly known as PPE for long-term care Ombudsman. When providing in-person advocacy for residents living in long-term care facilities, proper use of PPE will reduce the likelihood of catching or spreading contagious diseases. The wearing of PPE may feel foreign, but with a little practice, you will feel confident and view it as a tool that allows for in-person advocacy and keeps both the residents and the Ombudsman safe. Here's what you're going to need. This video demonstrates the donning and doffing procedures of PPE for varying degrees of risk mitigation to reduce the spread of infectious diseases. Don't worry, Ombudsmen don't provide direct patient care, so these procedures are for risk reduction and often simply wearing a mask will do. Donning Scenario 1, mild risk. When providing advocacy for residents who are able to physically distance, have the ability to wear masks, and who are known not to be contagious, the following PPE is recommended. Cloth mask or disposable surgical mask. The donning process always begins and ends with good hand hygiene. Proper hand washing is the best way to reduce the spread of viruses. Ideally, washing with soap and water for a minimum of 20 seconds is the best approach for performing hand sanitization. If soap and water are not available, use liquid hand sanitizer. Start with a dime-size amount in the palm of your hand. Rub hands together, making sure that you rub around the thumbs, between the fingers, and under the nail beds. Continue rubbing your hands until the liquid sanitizer is rubbed into the skin and has evaporated. The next step is donning a disposable mask. When using cloth or disposable surgical masks with ear loops, place each loop behind the ears. If noseband is provided, pinch the noseband to mold to the shape of the bridge of your nose. Ensure airways are covered from the bridge of your nose to the base of your chin. When doffing a cloth mask or disposable surgical mask, do not touch the outside of the mask as it is contaminated. Instead, use both hands to remove the loops from behind the ears, letting the mask fall away from your face. If a mask is recyclable, put it in a bag and launder. Perform hand hygiene. Donning Scenario 2, moderate risk. When providing advocacy activities for residents who cannot wear a mask, require the Ombudsman to stand closer than 6 feet apart, and are not known to be contagious, the following PPE is recommended. Cloth mask or disposable surgical mask, or N95 respirator, face shield, gloves are optional. As always, the donning process begins and ends with good hand hygiene. Start with a dime-size amount in the palm of your hand. Rub hands together, making sure that you rub around the thumbs, between the fingers, and under the nail beds. Continue rubbing your hands until the liquid sanitizer is rubbed into the skin and has evaporated. When donning a cloth or disposable surgical mask with ear loops and noseband, you secure the loops behind the ears and pinch the noseband to mold the shape of the bridge of your nose from above. Grasp the nose piece with one hand while pulling the bottom of the mask to cover the chin. Make sure the mask completely covers your nose and mouth. Your mask should be secure so that it doesn't slide off your nose, but not so tight to make speaking difficult. Now you're ready for the face shield. Start the donning process using one hand to hold the foam headband in place on your forehead and use your other hand to secure the elastic band over your head. Make sure that the face shield covers the front and sides of your face. The face shield should fit snugly but comfortably. An optional piece of PPE is wearing the disposable gloves. Perform hand hygiene before putting on gloves. Put on gloves one at a time. Congratulations! You're all set and ready to proceed to in-person facility visits. If you chose to wear gloves, remove your glove first by pinching the outside of your glove and pulling away from your hand. For the second glove, place your clean, uncontaminated finger inside the glove and pull away from your hands. When removing the face shield, be careful to avoid touching the clear plastic shield, as it is considered contaminated. Instead, use both hands to pull the strap over the top of your head and away from your face. Use a disinfecting cloth to first wipe down the inside of the face shield and headband, and then the outside of the face shield. Allow the face shield to air dry and place inside a paper bag for storage and reuse. The next step is to remove the mask. When doffing a cloth mask, disposable surgical mask, or N95, do not touch the outside of the mask as it is considered contaminated. Instead, use both hands to remove the loops from behind the ears, letting the mask fall away from your face. If the mask is recyclable, put it in a paper bag and launder. Perform hand hygiene. Congratulations! You've successfully doffed your PPE and are good to go. Donning Scenario 3. Higher risk. This scenario is recommended when you will be providing advocacy for a resident who is known to be contagious, when the facility has high levels of infection, when the Ombudsman is unable to remain 6 feet away from the resident due to room design or resident sharing rooms, when a resident is unable to wear a mask due to physical or cognitive limitations, where the resident is hearing impaired, soft-spoken, or any other situation which requires the Ombudsman to stand close. The following PPE is needed: a gown, an N95 mask, and a face shield with gloves. Again, the donning process begins and ends with good hand hygiene. Start with a dime-size amount in the palm of your hand. Rub hands together, making sure that you rub around the thumbs, between the fingers, and under the nail bed. Continue rubbing your hands until the liquid sanitizer is rubbed into the skin and has evaporated. Gown. Start by opening the package. Perform a quick check to make sure the gown is clean and has no rips or tears. We begin the donning process by inserting the arms, securing the gown at the waist, and then tying the gown at the neck. Take a moment to make sure the gown fully covers the body from the neck to the knees and the arms to the end of the wrists. Be sure your shirt sleeves do not extend past the elastic wristband. Next comes the N95 disposable respirator. An N95 mask is a fit-tested type of respirator which filters the wearer's exhaled breath, removing at least 95% of the microscopic particles. Before using your mask, make sure to get fit-tested and retest each time you change the manufacturer of your N95 mask. To start the donning process, you should do a quick visual inspection to ensure the mask is clean and in good working order. Start the donning process by placing the N95 in the palm of your hand so that the two elastic bands hang freely and are not tangled. Next, use your hand to bring the mask to your face, covering your nose, mouth, and chin. Hold the N95 in place with one hand, and with the free hand, take the uppermost elastic strap, lifting up and over your head, securing the elastic band just above your ears. While still using the one hand to hold the mask in place, use the other hand to take the second strap over your head just below the ears. Make sure the straps don't overlap or get twisted. To ensure a proper fit and seal around the nose, use the fingertips of both hands to bend the metal nose band around the nose. Start at the center and work your way around the bridge of your nose. Now perform a seal test. Place both hands over the mask, take a sharp breath in, and make sure the mask is sealed over the face during the inhalation. Keep both hands on the mask and exhale. While breathing out, feel for any air leaking out around the nose piece or mask perimeter. If air is leaking out, try rebending the metal noseband with both hands and recheck the seal. If air continues to leak out, try adjusting the elastic straps to ensure that hair, jewelry, or other clothing is not caught in the straps. If you still feel air leaking out, you may need to be fit tested for a different size N95. Do not use the respirator if a proper seal cannot be achieved. Now you're ready for the face shield. Start the donning process using one hand to hold the foam headband in place on your forehead and use your other hand to secure the elastic band over your head. Make sure the face shield covers the front and sides of your face. The face shield should fit snugly but comfortably. Before putting on the gloves, perform hand hygiene. Put on gloves one at a time, making sure that the gloves extend to cover the elastic band or cuff of the gown. Don't worry, everyone tears a glove at least once. In that case, just put on a fresh new glove. Congratulations! You're all set and ready to proceed to in-person facility visits. Doffing Scenario 3. You begin the doffing process first by taking off the disposable gown. Remember, the front of the gown and the sleeves are considered contaminated. Untie, unsnap, or break the ties around your waist, then neck. Using a shrugging motion with your shoulders, loosen the gown so that it starts to fall forward and off your shoulders. Be careful to only touch the inside of the gown, rolling the gown downward and away from your body. Pull the arms out of the sleeves inside out. Remove the gloves, pulling them off while pulling your arms out of your sleeves. Gather the gown into a ball so that you do not come in contact with the outer contaminated part of the gown. Dispose of the gown. Perform hand hygiene. The next step is to remove the face shield. When removing the face shield, be careful to avoid touching the clear plastic shield as it is considered contaminated. Instead, using both hands, pull the strap over the top of your head and away from your face. Using a disinfecting cloth, first wipe down the inside of the face shield and headband, and then the outside of the face shield. Allow the face shield to air dry and place inside a paper bag for storage and reuse. Always remember to sanitize your hands. Next, remove the N95 mask. When doffing an N95 disposable respirator, do not touch the inside of the mask as it is contaminated. You start the removal process using both hands and pull the bottom strap to the sides and over your head. Bending slightly at the waist, lean forward, allowing the top elastic band to hang loose away from your face. Using both hands, extend the upper elastic strap to the sides, away from you, and over the top of your head. Allow the mask to fall away from your face. Dispose of the N95 respirator. The doffing process's final step is to ensure that the trash is secure. If you cannot dispose of the PPE inside the facility, then be sure to dispose of the used PPE in a trash bag, being careful not to contaminate your supply of clean PPE. If possible, end the doffing and disposal of PPE by washing your hands with soap and water. If that is not available, perform hand hygiene using hand sanitizer. Congratulations! You have successfully donned and doffed your PPE for each scenario.